And let's go to this conversation now. A new study by the South African Medical Research Council reveals that HIV remains one of the leading causes of death in the country, with evidence suggesting that doctors often underreport fatalities linked to the virus. According to the Council, 23.3% of the deaths in 2018 were related to HIV and AIDS, while Stats SA reported only 4.9% of the registered deaths were due to HIV in that period. For more on this, we are now joined by Dr. Pamela Groenewald, a scientist at the South African Medical Research Council and also the co-principal investigator of this study. A very good morning to you, Dr. Groenewald. Thank you so much for making time for us this morning. What necessitated this study before we go into its findings?
Okay, so it's very important that we have accurate cause of death data for health policy and planning. Cause of death data is the only routinely collected health data that covers the whole population. Every person who dies needs to have a death certificate certified by a doctor and a cause of death documented on that certificate. So it's really important that information is accurate so that one can accurately prioritize diseases and target interventions appropriately.
Yeah, and sometimes when we look at the death certificate, the cause of death, we will be told that it is natural causes. In this particular case, when it comes to HIV/AIDS, would it be explicit that it is HIV/AIDS related? Should that be the indication?
I think, perhaps we're confusing two things. The yellow death certificate that is issued by Home Affairs to somebody after the death is registered will only show natural or unnatural or undetermined. It's not allowed to show any causes. The cause of death or the medical certificate of cause of death is on the last page of a 4-page death notification form. And there the doctor is expected to fill in the causal sequence leading to death. So it might be HIV resulting in TB causing death and any contributing causes that may have, contributed to the death.
All right. And from the information and the evidence that you've gathered, what did you find?
So what we did was we compared the causes reported on official death certificates with data that we gathered from medical records, from forensic reports, and from verbal autopsy interviews. And the information we collected from the medical records and forensic records were reviewed by clinicians, and they assigned a cause of death, based on the information in the medical records. We linked those records, and then we compared, the causes. And we found that there was very poor agreement overall, with only about 36.9% matching, the causes matching for over 15,000 linked deaths. There was significant underreporting of HIV and AIDS, and also misclassification of injury-related deaths, especially suicides. Shall I carry on?
Sure, you can carry on.
So, as we mentioned, HIV and AIDS remain the leading cause of death, accounting for 23% of all deaths. There's a very strong link between HIV and TB, with TB responsible for about 45% of the deaths in people with HIV. Now, if you have TB and HIV in a person, it's the HIV that cause the person to have TB. So HIV would be the underlying cause of death in those cases. And then 63% of all TB deaths occur in individuals with HIV. The other thing we found was that homicide and road traffic accidents moved up into the top 10 causes of death. They are not in the top 10 in the official cause of death data.
Yeah, and if you look at the Stats SA data, it shows that leading cause of death, TB at 6.3%. With that underreporting, what dangers lie in that?
So the danger is that health planners may look at that data and accept it at face value and plan according to the ranking of, the prioritize the diseases based on the ranking from the official cause of death data. And TB, well, the danger is that HIV won't get the priority that it needs because it is the leading cause of death, but it's not showing up as such.
Yeah. And from your investigation, and I don't know if you've had any oral conversations as well, the face-to-face verbal autopsy interviews as well. So from those verbal autopsy interviews, were you able to ascertain why there is this under-reporting when it comes to HIV/AIDS deaths by doctors?
No, because a verbal autopsy is an interview with the next of kin of somebody who died. So what we do in a verbal autopsy is interview that person with their consent about the events leading up to the death of their relative. So we ask them for a narrative, just to tell us the story in their own words. And then there's a structured questionnaire asking standard questions about the medical history, any signs and symptoms that they showed, any treatment that they received, and any, the response to the treatment. So it doesn't tell us why doctors are reluctant to report HIV on the death notification form.
Is this a question that should be answered, though? And I don't know how we're going to getting what that particular answer is.
Absolutely. We've had some discussions in workshops with doctors where we've spoken about how to certify a cause of death. And the biggest thing that comes up for them, I think, is confidentiality. Now, we tried to address that in 2014 by making the last page of the death notification form, which has the medical certificate of cause of death on it, self-sealing. So doctors are supposed to write the death, fill in the death medical certificate of cause of death on that last page, and then seal it before handing it over to the funeral undertaker or the family. I know that that's probably not the best way of, anybody could go and steam it open or whatever, but it's the best mechanism we have at the moment. We're hoping at some stage to get electronic medical certification of cause of death, which will take away that problem completely.
Yeah, and from the data that you've collated, does this data at all give us an indication around whether, look, we have the 95, 95, 95 target for 2030. Is our treatment campaign actually working? Does it give us that indication at all? Because if we are saying that, if your report says that 23.3% of the deaths in 2018 were HIV/AIDS related, which is way less than what Stats SA is reporting, at 4.9%, what does that then tell us about our treatment campaign?
Thank you. That's an excellent question. To be honest, there is no linking between the way the HIV register, which works out those 90 estimates, the care cascade outcomes, and we feel that we should be linking death data, which the MRC collects, with the HIV register, so that we can identify deaths that are perhaps recorded as lost to follow-up in the official, in the health register that the department keep and use for those stats. So, we don't really know.
We don't really know. What are you going to do with this study? How should the Department of Health and all the various provinces, also considering, of course, that health is a provincial competency, engage with this data?
So what we're trying to do is engage with the HAST programs, and we've already presented to SANAC. We are saying that the department should strengthen the case finding, follow-up, prevention, treatment of HIV and TB to reduce mortality rates. And we need to have closer monitoring of the outcomes of these cases that are treated. We are saying that there needs to be careful interpretation of the official cause of death data when you're using it for planning, and one needs to look at multiple sources of data to ensure that we're not, we're not misinterpreting things. We also are working very hard to try and get the civil registration and vital statistics partners together. That's the Department of Home Affairs, Statistics South Africa, and Department of Health, to try and improve the data quality on the medical certification of cause of death. One of these is obviously to try and set up an electronic system. And also we are trying to disseminate some online training that we have to train doctors in medical certification and of cause of death. And then also urging the Department of Health to monitor the quality of those medical certificates before they're sent on to Home Affairs and Stats SA.